When I was growing up, periodically my dad would hop in the car and he would drive away and come back in 3 or 4 days. And then when I was 18, my dad was 36, he had a full-blown manic episode and wound up in the hospital. And as a kid, I had like no understanding of mental illness whatsoever. And my dad had what I call a pretty typical course. He got better, he got out of the hospital, he thought this was all a big mistake, he didn't have an illness, he didn't want to take the medicines, and he didn't like the idea of having a mental illness. Well, that was a time period where if you were going to the psychiatric ward, employers just fired you. I want other people to have what my family got. People supported him in that, and I'm very grateful for that. And I felt like I got a up-close and personal example through my dad of what recovery can mean for people. A part of the issue with mental health is that we haven't talked about it. This affects 1 in 5 people at any given moment in time, 1 out of 4 over the course of a year, and just imagine what our community would be like if it was just okay to talk about this. If you're mentally ill, you're dangerous, or if you're mentally ill, you're not competent to do anything. In fact, it's not true. People with mental illness are no more dangerous than people in the general population. So dangerousness is not about mental illness, it's about sort of our culture in general. There are a lot of things that people don't know about the Mental Health Center of Denver, and the things that we want them to know is that people can and do recover from illness, that people do get their lives back together, and that actually having people access treatment and engage in treatment fixes a lot of things that happen in our community. When you put yourself out there as the center of excellence, the national center of excellence, you have to think about what are the innovative things that you can do. We developed a set of instruments, our recovery instruments, that actually measure people's progress in recovery. We now are sharing with mental health centers across the country. We know that focusing on people's strengths makes a tremendous difference. And we have been incorporating the science of positive psychology into the work that we do. This is a relatively new science. It's only been around since 1999. Find out what people are good at and focus on what they are naturally good at so that they can be great at it. A part of recovery is that there are people that going back to work is very important to them, going back to school is important to them, reuniting with their family. So we have our To Succeed in Education and To Succeed in Employment program, and it really works on helping folks with those very specific goals. Because we have helped more people go back to work than any other center in the country, I have times where I run into people in the community that are working. So I stopped at a grocery store one day. It wasn't my usual grocery store, and I'm in the checkout line, and this woman says, she's like scanning the groceries, and she says, "I know who you are." And I'm like, "You do?" She goes, "Yes, you're Dr. Clark. You run the Mental Health Center of Denver." And I said, "Well, that's right." I said, "How do you know that?" She goes, "You guys helped me get this job." You know, and I mean, it's moments like that that this is what it's all about. And so, you know, I actually shop at that grocery store a lot more now. When I think about the hundreds of thousands of people that we've helped, I know in my heart of hearts that's made a difference.